Good afternoon. My name is Melissa Baglu. I'm an assistant professor of clinical surgery here at Columbia University with an interest in minimally invasive surgery and metabolic and weight loss surgery. What is metabolic syndrome? Metabolic syndrome is a combination of conditions which frequently occur together and raise a patient's risk for cardiovascular disease, diabetes, and strokes. It includes abdominal obesity with a waist circumference of over 102 centimeters in men and 88 centimeters in women, a fasting blood glucose or blood sugar greater than 110, hypertriglyceridemia with greater than or equal to 150, low HDL levels being less than 40 in men and less than 50 in women, and high blood pressure or hypertension. Currently, over 50 million people can be diagnosed with metabolic syndrome. Why is the treatment for diabetes so important? Diabetes is an epidemic both in the United States and worldwide. Over 25 million people currently suffer from diabetes, and this number is only expected to increase. This accounts for over 8% of the U.S. population. If not controlled, diabetes is associated with a number of other medical problems which have significant medical consequences. These include heart attacks or myocardial infarctions, vascular disease with ulcer formation and potential amputations, blindness, and kidney disease, which in its worst state requires dialysis. Medical treatment is often rigorous, and side effects of medications can limit the potential therapeutic options. Because of this, it's often difficult for patients to achieve good control of their diabetes. Can diabetes be prevented or delayed? The Diabetes Prevention Program, which was a large prevention study of people at high risk for diabetes, showed that lifestyle intervention, which included losing weight and increasing physical activity, reduced the development of type 2 diabetes by 58% in a 3-year period for all people. The reduction was found to be even greater amongst people older than 60 years of age, greater than 70%. Treatment with the drug metformin can also reduce the risk of developing diabetes by 31% overall, and it's found to be most effective in patients between 25 and 44 years and those with a BMI greater than 35. Prevention or delay of type 2 diabetes with either lifestyle or metformin has been found to be effective in all racial and ethnic groups that were studied and is shown to persist for at least 10 years. What is metabolic surgery? Metabolic surgery is the treatment of metabolic abnormalities with surgical alteration of the gut anatomy. This leads to improvement in the metabolic syndrome, which includes, as we discussed, high blood pressure and high cholesterol, fatty liver disease, and diabetes. Studies have actually shown that surgically induced weight loss is superior in treating these problems when compared to medical treatment. What operations are included in metabolic surgery? The operations that we perform for metabolic surgery include laparoscopic adjustable gastric banding, laparoscopic sleeve gastrectomy, laparoscopic Roux-en-Y gastric bypass, and laparoscopic biliopancreatic diversion and duodenal switch. Each of these operations can improve the metabolic syndrome to varying degrees. Some of the success of the operations is due to the associated weight loss, but we also know that some of the operations induce changes in gut hormones, which we believe have a role in the development of type 2 diabetes. What are the results for improvement of diabetes after these operations? Depending on the operation that's performed, rates for remission of diabetes vary. Laparoscopic adjustable gastric banding, which is the first picture you see here to the left, results in remission or improvement of diabetes in approximately 57% of patients. Roux-en-Y gastric bypass, which is the picture in the middle of the screen, results in remission or improvement of diabetes in 80% of patients. And the duodenal switch, which is the third picture that you see to the right of the screen, results in 95% remission or improvement of diabetes. These results have been obtained by reviewing a larger number of studies and ensuring that we have the highest value of information available to determine these numbers. The greatest rates of remission, as you can see, are achieved with the bypass or duodenal switch operations. We believe this is due to the hormonal changes that occur after alteration of the gut anatomy. The effect of the lap band on diabetes is due to the associated weight loss. How soon can the changes that are achieved with surgery be seen? Improvement in diabetes can be seen as early as days after surgery with the bypass or duodenal switch operations. Some patients are even able to leave the hospital off of all diabetic medications. The time for improvement after the laparoscopic adjustable gastric band is variable and based on weight loss.